Hi everyone, I'm Amy Stacy, one of the DJUSD school nurses. Today I'm going to talk about how to screen your student for illness, which is critical to slowing the spread of contagious diseases like COVID-19. I will also cover considerations for students with seasonal allergies and asthma. We can all do our part to keep our families, our students, and our communities safe and healthy by self-screening daily and staying home if we have any symptoms of illness. COVID-19 most commonly causes cough, fever, chills, body aches, shortness of breath, sore throat, or new loss of taste or smell. It can also cause other symptoms, including diarrhea, nausea and vomiting, fatigue, headache, lack of appetite, nasal congestion, and runny nose. Self-screening for symptoms each day before leaving the house is essential. The district has a self-screening guide available to help, which can be found on the Restart DJUSD website. The screening checklist covers possible exposure to COVID-19, symptoms, and basic guidance. If your child has had close contact, which is defined as within 6 feet for 15 minutes or more, with or without a face covering, with anyone diagnosed with COVID-19 within the last 14 days, check yes. A COVID-19 diagnosis can be either through testing or symptom diagnosis by a doctor. The most common symptoms of COVID-19 are listed on the checklist. Please note any of these symptoms that have been experienced within the last 72 hours. To screen a child for symptoms of illness, first look for signs of coughing, difficulty breathing, pale or flushed skin. Then ask about symptoms. Are they feeling tired or achy? Do they have a sore throat or a loss of appetite? Do they have a new loss of taste or smell? Finally, take a temperature. A fever is usually considered a temperature of 100 degrees Fahrenheit or greater. It's a sign the body is fighting off an illness. But sick children may not always have an elevated temperature. If a student looks pale, flushed, sweaty, tired, or weak, these are all objective signs of illness and should be considered when self-screening. In children and adolescents, COVID-19 often presents differently than in adults. Children and adolescents can be infected and contagious but may not feel sick, or may have very mild symptoms, some of which can be similar to the flu or common cold. Additionally, children may have only GI symptoms like nausea, vomiting, or diarrhea. They may be less likely to have a fever or may be less likely to present with fever as an initial symptom. This flyer provided by Yolo County Health is also available on the Restart DJUSD website. It outlines some of the differences between COVID-19 symptoms and other common respiratory viruses like flu or cold, and non-contagious allergy symptoms. For students with seasonal allergies, some of the symptoms are similar to those of COVID-19, but allergies are not contagious, and it's okay to go to school. Please make sure the school knows to expect allergy symptoms in your child by reporting any history of seasonal allergies in the medical information section of the parent portal. And for those students with a history of asthma, please report this information as well. Asthma also presents with a dry cough and difficulty breathing. Work with your healthcare provider to manage symptoms with daily maintenance medication and arrange to have an emergency inhaler at school. Students must have documentation on file for any medication at school. For more information, please visit the district's COVID-19 Restart DJUSD website under Health and Safety. The resources we reviewed today can be found under Check for Signs and Symptoms of Illness. Thank you for watching and stay safe.